Okay, we'll get started. I'm sure more will join in the next few minutes. Thank you all for being here today. I'm April Harrington. I'm the project manager of the Chicagoland Healthcare Workforce Collaborative. And today is our first Lunch and Learn, virtual Lunch and Learn of the year. Thank you so much to Susan Plattner of Endeavor Health, formerly NorthShore Elmhurst. She sits on our steering committee and has put together this program today in partnership with our representatives, Jessica Cooper and Jeremy Brown from the City of Evanston. If everyone else could just take a minute to introduce yourself in the chat so we all know who's joining us, that would be great. For anyone who is new to CHWC, we are an employer-led healthcare collaborative with all of the major health and hospital systems in Chicagoland at the table. And we are here to join with our industry partners, community organizations, training providers to create a more inclusive healthcare workforce. We do that by focusing on local and targeted hiring, by talking about different strategies to approach different groups who might be experiencing more unemployment or underemployment. We do that by bridging the gap with our education and training providers and innovating in the ways that we prepare folks to enter our workforce, and also by focusing on retention and career pathways so that we're not just bringing people into the front lines and leaving them there, but offering opportunities to advance through a progressive career pathway. Here's some of the major health and hospital systems who are at our table. Over 12 employer partners are engaged, and more than 20 strategic partners are at our table as well. This is our 2024 calendar. So our next quarterly meeting is on March 12th. That's a virtual meeting. And then we'll have 2 in-person meetings in June and September before another virtual meeting in December. All of those dates are listed on our website, and the virtual ones have registrations already up. So if you are not already registered, go ahead and do that. And if you are an employer, so if you are a representative of a health or hospital system, we are doing a cool event this February, which is a peer learning and planning event. We're doing it in person. Our steering committee has decided that we need to lean into our space as a peer learning space a little bit more heavily in 2024. So it's going to be highly discussion-based, interactive, in small groups, and a real chance for peers across competing healthcare systems to talk about the observations they have on the ground, opportunities and challenges, and identify what we would like to learn more about in 2024. So I'll drop the registration for that in the chat, as well as a link to our website. It's a refreshed website over the last several months, and it'll have information on all of our upcoming events, as well as recordings of our past events. So if you missed this today, or you want to share it with a colleague, or go back and look at something that you missed, the recording will be uploaded by tomorrow, along with the slides. So everyone will get the recording and slides for this. Oh, and somehow... Is anyone seeing not the 2024 calendar, but another slide? Something's wrong with my slides. I don't know what you're seeing right now, but it's supposed to be summarizing today's Lunch and Learn, which is all about ASPIRE Evanston. It's a partnership between Endeavor Health, the City of Evanston, the Evanston Township High School, as well as other partners. It's been going on since 2022. I've been very impressed with the level of partnership that is represented in this model. The fact that a large health system was able to work directly with a city or other municipality to launch such an innovative program. So I'm going to stop sharing and turn it over to Susan Plattner, the Manager of Diversity, Equity, and Inclusion at Endeavor Health, to get us started.
All right, give me 1 second to share my screen. All right, can everybody see my screen? Okay, and it's the pretty view, not the, you can see my notes to remind myself of what I'm supposed to say for review. Right? We're all good? All right. So thank you everybody for joining us today. I'm extremely excited and extremely proud to share with you the success story of ASPIRE Evanston, along with my partners from the City of Evanston. And so before we dive in, I do want to just acknowledge and recognize first Jessica Cooper. So Jessica Cooper is the Workforce Development Coordinator for the City of Evanston. She also is the OG, so the original ASPIRE program coordinator, and really helped us apply lessons learned that we had in the first year of ASPIRE. She joined us right when we were wrapping up our first year and helped really launch and expand the program in 2023. And then I'll let Jessica and Jeremy introduce themselves. And then Jeremy just recently joined us as our new ASPIRE program coordinator of the City of Evanston. So just give Jessica and Jeremy each an opportunity to introduce themselves before we jump into our presentation.
For sure. Thank you so much, Susan, for that introduction. Good afternoon, all. Jessica Cooper. I am, as Susan mentioned, with the Workforce Development Division for the City of Evanston. Along with that, the title comes very important to me because I am an Evanston native. And so Evanston is home. It's kind of full circle because being in workforce development, I started in the summer youth employment program here with the city. So my role comes full circle to seeing exactly how we transform lives for the City of Evanston. So I'm so happy that you all are here, so happy to talk with ASPIRE, talk on behalf of ASPIRE and the Workforce Development Division as a whole within the City of Evanston. So thank you again. Jeremy.
Yeah, thank you. To kind of echo the sentiments that Susan and Jessica shared, as she said, pretty new to the role. It's been about 2 months now, and just picking up more with each day that goes by, and just more and more excited to continue to grow and expand what ASPIRE Evanston is and what it can be. I personally come from a public health background and just very passionate about the work that we do through the City of Evanston and our Workforce Development Division, as well as the ASPIRE Evanston program specifically, because I feel that employment very much so is a public health issue, and ensuring that we're doing work to get people employed, just very essential for the growth and overall benefit of the communities that we serve.
All right. Thank you, Jessica and Jeremy. So Jeremy and I are now going to share with you about really what is ASPIRE. So we're going to introduce you to how did this even come about? How did we decide that we wanted to partner with the City of Evanston? Share with you the impact that ASPIRE Evanston has had, share with you our initial plans for 2024, where we see the future of ASPIRE going, both within Evanston and within other communities in which Endeavor Health is located. Share with you some key lessons learned that we think would add value to all of you. These are key components that we realize have proven to be a key to success. So what is ASPIRE? So the ASPIRE program really started out as a dream. Literally, it's one of those, put a note on a napkin or piece of paper that was kind of several years in the making from an idea perspective. So my role is currently Manager of Diversity, Equity, and Inclusion for Endeavor Health. Prior to that, I spent 10.5 years managing our Learning and Development department. And one of the things that I had shared with our Vice President of now DEI and People Strategy, Samir Desai, when he first started was, how do we invest? How do we invest in our community? How do we develop community members to eventually come in and work for us? In 2021, we were then known as NorthShore University Health System. We also had made an organizational commitment to investing in the communities in which we are located. We really wanted to make sure that the representation and the team members that worked for us represented the communities in which we were located, and that we were doing a more active job of investing in the community by developing community members and creating a pipeline into our system. So we created a formal commitment to accelerating opportunity, inclusion, and health equity by creating new opportunities for personal, professional, and economic growth across our communities. At the same time, the City of Evanston created their workforce development division. And it was one of those partnerships where we approached the City of Evanston to say, how could we invest in the community? Where do you see a need? And the city had identified that there are easy ways for us to support some existing workforce development programs that would be a natural fit. And so we'll share who those community partners are, but we were able to then apply as a system or as a program to our own community investment fund. So ASPIRE Evanston is funded through a three-year grant that Endeavor Health gave our program that was matched by the City of Evanston and also matched by the Finnegan Family Foundation. And so the city's invested financially in this program, Endeavor Health is invested in this program, and a local family foundation who are very active within the Evanston and the NorthShore area have also equally invested in this program. And I think that in itself shows the collaborative nature that not only are we partnering with the city, but they have equal skin in the game. They're equally invested. And again, our goal was to build a talent pipeline, diverse talent pipeline for qualified candidates for healthcare roles, and also providing opportunities to underrepresented members of our communities, and really those individuals who are generally underrepresented in healthcare. So this is a framework for our ASPIRE programs across Endeavor Health. We really look at career seekers. ASPIRE Evanston in particular, we're really invested in our high school rising juniors and rising seniors and recent graduates. We are looking at local area college students who are going to local universities, in addition to community members who are maybe not in college, but are 18 and older, have graduated from high school, and are looking either for employment or are looking for a career change. Our system is really focused on launching careers through job shadowing, career fairs, creating formal teacher partnerships with Evanston Township High School. We formed other teacher partnerships in Lake County. We have started to explore with the city creating a digital career portal. We also are invested in career acceleration. So all of our internships and job shadowing actually are paid. That is something that was very important to both us and the city, that we wanted to pay anybody who came and worked for us, even if it was just for 20 hours over 1 week. We are investing in providing scholarships and certifications. And again, our ultimate goal is to introduce local area youth and adults to potential career pathways that they could have. Also connecting local community members to entry-level job positions that we may have openings for. So collaboration has really, and I can't emphasize this enough, been the ultimate key to success. This is a program that would not exist if it were not for the strong partnership we have with the City of Evanston. In addition to a partnership we have with Evanston Township High School and their iKIT program, which was started by the mayor and the city, and now is owned by the high school. The Evanston Work Ethic program, also known as the Evanston WE program, is a critical partner with us, along with Oakton College, who we have set up an ASPIRE scholarship for students who are exploring and getting certifications and degrees in healthcare. So Our Evanston iKIT program and the Evanston We program are the key partners who help us recruit, identify, interview, and place those individuals who end up coming to us as interns in the summer. iKIT also partners with us over their spring break. So both iKIT and We, or the Evanston We program, work with about 20 other employer partners throughout the city of Evanston. So Endeavor Health is really just one of 20 partners. And so that's kind of how we got into this whole program, was we saw a need to invest in the community, and iKIT was looking for employer partners, and Evanston We was looking for employer partners, and the city was looking to create a stronger relationship with employers within our community. So we realize collaboration is critical. And so to really get your ideas, we want to find out from all of you examples. And if you want to either take yourselves off mute or put it in the chat, what workforce development collaborations have you formed? And then also sharing what successes and challenges have you had in building collaborative partners?
We're
So we'll be sharing.
a group here today. If anyone wants to just jump in, take themselves off chat or off mute, and share. What kind of collaborative partnerships are you trying to build within workforce development?
And if it's, we don't even know where to begin, that's helpful too, because we can share again some other ideas of how we're approaching the expansion of ASPIRE too.
Hi, this is Nicole Vall from the Illinois Medical District. We don't have a kind of set like workforce development program, but we do have an education council that we formed that has all of like the elementary and high schools in and around the Illinois Medical District. And we're kind of working towards this. Like, how can we provide youth different opportunities on different levels depending on their needs? And so we're still trying to kind of figure that out, but that's kind of where we're at right now.
Right, thank you.
Mm-hmm.
Hi, good afternoon. Oh, did someone else want to go? Okay, I'll go ahead. I would say for us, so I work for DeVry University, and I'm responsible for supporting state governments as well as economic development agencies and workforce development organizations with upskilling and reskilling in the space of tech, manufacturing, and healthcare. And so the focus is to make certain that we can provide the industry-specific training that is necessary for individuals to get the skills they need to be successful in those roles. And so working with those three entities, including employer partners, is what I'm responsible for as the manager of public workforce solutions.
Great, thank you.
Hey everyone, I'm Rhiannon Clifton. I'm with the University of Illinois System Clinical Laboratory Development Program, and we are focusing on an apprenticeship for clinical labs in various areas, supported both by colleges and universities throughout the state, workforce development organizations, and hospital and reference laboratories. So really focusing on getting more people into the lab pipeline and then getting them ready for certification.
Great. And Tamara, we see in the chat too, added her link to the New York Presbyterian Hospital paid internship program, which sounds phenomenal.
Yes, we have a partnership with New York Pres. We're a national organization. We worked with skilled immigrants and refugees and looking to figure out models locally for the job seekers that we support in the Chicago area. Happy to chat with anyone really interested in apprenticeship programs. A lot of our folks come as specifically doctors, but all sorts of trained health professionals, and need to be working to support their families, but want to figure out pathways into healthcare. So.
Great. Thanks, Tamar. All right. So, feel free to share. We can go back to the chat and share anything in the chat too. But I think we all, when we get to our lessons learned that we've discovered over the last 2 years and entering our 3rd year, I think what we're going to realize is a lot of our lessons learned are common with other employer partners and other community partners. What we're facing is not necessarily unique. And so we are open to sharing what we've learned and also learning from all of you. So Jeremy, I'm going to turn it over to you.
Yeah, thank you, Susan. And as Susan mentioned earlier briefly, we have essentially 4 areas of focus for the ASPIRE program. And the first of those is our job shadow opportunities. And currently, we carry these out through a partnership with Endeavor Health, as well as functioning as one of the employer partners for Evanston Township High School. And we partner with them during their spring break each March or April, whenever it falls, and give the students an opportunity to come in and take time out of their spring break week and shadow under host managers within 1 to 2 different departments. And I really enjoy being able to offer something like this because for those high school students, it serves as a great explorative opportunity, and it gives us an opportunity to help guide their direction. Maybe they realize that they really enjoy that area of work or that department that they had the opportunity to shadow within, or maybe we help them learn that this isn't exactly what I want, and this might not be an area that I'm as interested as I originally thought. And building from there, we have our summer internships. And currently, I sort of look at this opportunity as our bread and butter for the Aspire program. Right now, our internships function as a 10-week opportunity over the summer. And we really, as of right now, focus on that main age group in the middle that Susan mentioned earlier, being those 17 to 30-year-olds for our opportunities. And this is like taking the job shadow opportunities and really scaling it out. We have a wider range of department opportunities that are offered, and a wider range of overall number of opportunities that we offer, because we want to be able to get people into different areas and not just say, oh, we have this one specific internship for this one specific area of interest. So taking that time to really build that out is important because we give people an opportunity to explore a wide range of opportunities. Continuing from there, we have our scholarship partnerships, as Susan mentioned, with Oakton Community College, which pretty much offers those scholarship opportunities to students within their academic system who are pursuing health-related programs, as well as a newer partnership that we have recently finalized with Evanston Community Foundation. And the goal of this scholarship opportunity is to essentially provide community members with financial assistance to help them gain the necessary credentials that will then allow them to pursue their given career interests. And the last point we have on here are career fairs and events. And I think these, and participating in these, are essential for any successful program because it gives people an opportunity to do a few things, one of which is put a face and a name with your program. It gives you an opportunity to connect in person and one-on-one with individuals within the community. Because it's one thing to meet in the areas like we do now virtually, but really being able to be face-to-face is where so many meaningful relationships are able to be fostered and developed between the role that we play, often as employers and managers and actual community members. And so now I'll go a little bit into what the actual impact of Aspire has looked like as we're now entering our 3rd full year of operation. So as you can see on the left side of your screen there, speaks to the impact we've made through our scholarships thus far. In our first full year of operation, that 22-23 academic year, we dispersed about $11,000 in scholarships. And thus far in the 23-24 academic year, we've dispersed just about $37,000 in scholarships. Again, you see the references to the newly formed Evanston Community Foundation Scholarship, as well as the partnership with Oakton College. And then on the right, although we are just now entering our third full year of operation, you'll see 3 figures at the top of the screen for the number of interns that we've hosted during our summer program. And that first figure of 4 represents the kind of how Susan mentioned that the program started just with an idea written on a sheet of paper. The ASPIRE program originally started very much so as a pilot program, so to speak, where it was assessed to see, can this work and how can we be successful with an initiative like this? And once it was determined that, hey, this is something we want to do, the program just had an opportunity to blossom and grow from there. As you can see in our first full year in 2022, we had 33 summer interns. And last year we grew that number to 48 interns. And this is a number that we truly do want to see continue to grow in different ways. Obviously, having that raw number grow every year is something that we want to pride ourselves on. As this year we have goals of really growing that number to somewhere closer to 60 or even 70 if possible. And as I mentioned, we host these interns in a very wide variety of departments. And I think that's something that's very unique to the ASPIRE program. It doesn't just focus on the clinical side of what goes on in a hospital, but we also give interns an opportunity to explore the non-clinical side because each of those roles is very important to the overall success of a healthcare system. And just continuing with a little bit of the numbers from the first 2 years of operation for the program, you can see that from year 1 in 22 to year 2 in 2023, we over doubled our job shadow students. We're looking to, again, grow that number this year once more over the spring break period. And we did the same with our summer interns for our summer program. And something I really want to bring attention to is that figure on the right side of the screen where it speaks to the 7 interns that we have hired currently within Endeavor Health. And you can see that, as I've mentioned a couple times, the roles there are diverse. And I continually highlight that because I think it is important given the resources that we have access to, being on the operation sides of things, that we're making sure we're doing everything we can to give people an opportunity to explore a very diverse range of career paths. And that's why those earlier opportunities, such as the job shadowing or the summer intern program, are so important because there's a level of commitment that comes once you've gotten to that point of employment. And so you can play around with things a little bit more when you're shadowing or when you're an intern. And that doesn't minimize the great work that people do in those roles, but it does just essentially give you that opportunity to explore and see what you're truly interested in. And then here we have a few of our summer intern testimonials. And what I really like from these quotes here is, again, it speaks to our ability to help our participants and the role we play, rather, just helping guide their direction. Are we able to say when they graduate from our program and they take their next step away from Aspire, that we help them solidify what they want to do with their career, what they want to do really in a lot of cases for the rest of their life, and whether or not we were able to help them pencil in and determine where their interests truly lie. And you can see and read those quotes and just speaking to them feeling more confident after job shadowing or interning in what they want to do in pursuing higher education or pursuing different career paths. And following that is one of our manager testimonials, which comes from Pat Lyons, who is currently a program manager in health equity. But Pat was formerly a practice manager in the Neurosciences Institute. And what I really enjoy about the quote that Pat shared with us is how she mentions the mutually beneficial relationship that she has as a manager, as well as the interns that they host, which I think is really important because we never want the opportunities to feel like a one-way street for either side of things, whether that's on the Endeavor and hospital side or for the intern as well. We want to know that we are really fostering and investing in their growth. And we also want things to feel meaningful for our host managers. We want them to truly understand the value in being able to pour into an intern and getting that return back tenfold. And as Pat mentioned, that piece of pouring into the community and then having them pour back into the healthcare system, I think is just incredible.
All right. So through a lot of hard work, a lot of sometimes challenging conversations, we have realized that this program can be successful, and we as a system are committed to expanding it throughout all of the areas in which we're located, with our next program being rolled out not just to one community, but to an entire county. And so we have been tasked with introducing Aspire into Lake County. You'll see in the photo, we have two of our recruiters next to Jacob Schultz. Jacob is our workforce development program manager for Endeavor Health, and his goal and his role is to roll out and replicate this program somewhat. So what we've decided is we want to make this bigger and better, and we have started to partner with the communities you see in that table, which is Grays Lake, Round Lake, Highland Park, Highwood, Deerfield, Waukegan, and North Chicago. And we are wanting to bring internships, career exploration opportunities, job shadowing, career events to these communities within Lake County. What we did is we partnered with these different communities to find out, one, within Lake County, where's the highest rate of unemployment? What are the high schools and school districts that have programs similar to the Evanston iKIT program, the Evanston We program that we can tap into? And so we've gotten to form partnerships, really strong partnership with the Grays Lake High School District and Round Lake School District, where we're already hosting their internship students during the school year. They come and they work 2 to 3 days a week for us for an hour at the end of the school day. We are working with the Highland Park High School District, or Highland Park Deerfield Highwood School District, in creating workforce development and career exploration programming and hosting a one-day career exploration event, and also including Waukegan and North Chicago. So we are kind of going big or going home kind of attitude here. You'll see the different community partners and logos of the organizations we have formed partnerships with to figure out how do we bring Aspire to Lake County community members post-high school. So a big component of that is creating partnerships with universities. So we're working with the University Center of Lake County, College of Lake County, the Lake County Workforce Development Division, the Lake County Tech Campus for high school students, and Youth Build is an organization that we're starting to really explore how can we partner with them. The photo you see with Jacob in it is a Lake County internship and job fair that the county held, that we were able to participate and introduce community members to the different career pathways and our top 10 hot jobs that we're currently recruiting for. So what are our lessons learned? There are a lot. So this list was really long and I kind of condensed it, but these are things that we give other organizations who will call me, school districts who call me to ask, what would you tell us to do or not to do? And what we've realized is these are keys to success. The first is having a day-to-day point of contact for interns who is physically there with them every day. This doesn't have to be the same person. It can be a lead within your department who could be maybe 2 or 3 people. They rotate and they work together to host interns. We recommend creating a formal internship training plan prior to the intern start date. Some of our host managers have done this, some of our host managers have not, and we've realized that those who do create a formal training plan are way more successful in providing an exceptional experience for the intern than those who kind of wing it after week 1. Giving interns exposure to all areas of the department wherever possible. So we do try to align interns to shadowing and interning with entry-level positions, but we also have found a lot of success making sure that that intern gets to interact with everybody that's part of that team. So if they are shadowing with a medical assistant, they also have an opportunity to meet a nurse, work with a physician for a day, work with maybe a lab team member who's there as a phlebotomist for the day, and looking at how that medical assistant role is just one of several roles that really impact the patient experience. We've found that to be very engaging. Delegating mentorship and training is a growth opportunity for team members. Our managers who delegate and get their team members who are aspiring to be leaders themselves involved with mentoring these interns or job shadow students has been extremely impactful, not just for the students and interns, but for those team members. Managers keeping in touch and escalating concerns to the ASPIRE point of contact. Unfortunately, sometimes we hear from a manager at the end of the summer, at the end of that 10-week period, that they had challenges with their intern, and they were not sure how to escalate feedback because they didn't want to get the intern in trouble. So we are going to go out of our way and a little overboard this year in emphasizing that Jeremy's here and I'm here to coach managers through these situations and to also help with those conversations with the intern, so that that intern gets the coaching as if they were an employee. They get that mentorship that they really deserve to receive. We have found professional development sessions to be extremely valuable. We have worked with, in 2023, we partnered with the Youth Job Center, who delivered training on everything from what does it mean to be a professional team member, to interviewing skills, to how to write your resume, to feedback, how to give and receive feedback, which was a very impactful session for a lot of the interns who this may have been their very first job. And then meeting with recruiters to learn about the different entry-level jobs that we had available, finding out what are the skills we're looking for those positions, finding out how they can actually formally apply, and having a point of contact in recruiting to ask questions just about what is the recruiting process. What can they expect when they do apply for a position? Our opportunities, so originally I had this as challenges, but I turn everything into a positive. And this list could be slightly longer, but we really wanted to focus on these 3 things going forward. And we realize after 2 years that interns come to us, and I'm not sure if other organizations experience this, I think you do. They think working in healthcare is what they see in the movies and on television. So we had a couple of interns working in our emergency department at registration, and they were a little disappointed that there could be a half an hour. They're just sitting there waiting for somebody to come in. They thought they'd be running down the hallway, helping transport somebody rapidly to another room. And that's not exactly what it is. So making sure that we set realistic expectations for interns and what to expect, not just about working in healthcare, but what level of hands-on experience are they able to get without having that formal education that a doctor needs, a nurse needs, and even some of our jobs that require certification. We also realize setting realistic expectations for managers on the skill set of an intern. Like I said, at the end of the 10 weeks in year one, I had several people come to me and say, I never realized my intern was only 16 years old. I didn't realize this is their first ever job. So we're helping them realize the background of their intern, the age of their intern, and why they are getting that particular person, and also encouraging them to have regular one-on-ones, get to know them as a person, that this is a huge opportunity for those managers and their team members to mentor. The second lesson learned is it's not as easy as we were hoping to connect interns to entry-level jobs upon completion of their internship. One is we generally only had one job that did not require a high school diploma, unless you wanted to be a volunteer. And that is a role that NorthShore University Health System, back when we were called that, created, called the Staff Support Technician, also known as an SST, that is unique to our organization. We created it as COVID started, and we realized that there were a lot of tasks that our patient care technicians were unable to complete, that we could use an extra set of hands for somebody who wanted to learn about healthcare but didn't have the additional education. It was a job that we created that would allow us to bring in 16, 17, 18-year-olds who were still in high school, along with college students or community members with a high school diploma who are trying to decide if healthcare was an industry they wanted to work in. The barrier we're facing is that a lot of the jobs that we're hiring for right now, our hiring managers want someone who's had 3-4 years of experience or has had that formal certification program. And so we are working this summer to figure out how can we align once an intern realizes that this is a job I want to apply for. If there's formal education that they will need or that will make them a qualified candidate, that we could move them into a job, how do we connect them while they're an intern to formal education? How do we get them into a program and get them financial support beyond even our scholarships that we have? So it's a lesson learned and a challenge that I think a lot of us can relate to, but that's a big one. And then the third one is connecting with community members 18 and older who are interested in healthcare for job shadowing and internship. And so the powerful thing about the City of Evanston is they have a workforce development division. They have Jessica and other team members who are out there connecting with community members. But what we also realize is that through the high school, when you want to get high school students, you just go to a high school. And there's 1,000+ kids at that high school that we can connect with. Once they leave that building and they graduate, the high school stays in touch with them until September. And then after that, it's somewhat on the student to keep in touch with the high school or the community. And so we're still figuring out who are community partners, how do we continue to promote the workforce development division at the City of Evanston, and that not only are they here to support Endeavor Health in connecting with community members, they're really there to help support all employer partners throughout their community. So it's something that we're working through. So questions for all of you are, we would love to learn from you. How are you connecting with community members that are looking for workforce development opportunities? And also, what successes or challenges do you face when building workforce development programs?
And I think the floor is just open to general questions for Susan and Jessica and Jeremy about Aspire. And again, we're small enough, so just come off mute and jump in. And
after if there are questions, after the questions, we will Jeremy and Jessica can share a little bit of information about the Workforce Development Division of the City of Evanston. Like I said, I often get phone calls from different superintendents across the North Shore area, and actually now in DuPage County, as we have expanded to be in Denver Health, asking, how do I do this? And I'll ask them, do you have a workforce development division? And they pause and think, well, no. But I think it's a key differentiator that the city has that has really helped us as an employer within the community.
So your first question, how do you connect with community members looking for workforce development opportunities? What we've been doing as of recent, and I'm actually a newbie to the organization, but as what we've been doing as recent is reaching out to community-based organizations, so nonprofit entities in particular, that basically workforce development is their wheelhouse. Economic and community development may also be related. And in doing so, what we've been able to do is kind of inquire about what has been bubbling up in their space relative to industry needs. We know what we may see in the surveys and research and so forth, but we really ask more specific questions relative to what their experiences in their respective areas. I'm responsible for 10 states, and actually Illinois happens to be one of them. So wow. We have reached out to a number of different organizations throughout the Chicagoland area. And even as of recent, I worked with them to create a collaborative effort on a grant so that we can support their workforce development needs. And so that looks like healthcare, again, tech, as well as manufacturing, because those seem to be pretty universal in terms of the various states that we're working with.
Thank you.
You're welcome.
Any other?
Ask a question of Susan and Jessica and Jeremy. I'm curious to hear how each of you, and perhaps even some of the other partners who aren't here today, define success of this program and why you're investing your resources in it. Because one of the things I find interesting is that right now, it's one of your opportunities is to find more bridges into actual jobs at Endeavor Health. And I'm sure Endeavor Health, as a partner in this, wants to see more of that conversion into actually having people on staff. But the City of Evanston, I'm sure cares just that residents are exposed to job training opportunities that might lead to a job in Endeavor Health. It might not. It could lead to a career with another healthcare employer down the line. As well as Evanston Township High School is happy to have their students exposed to career opportunities, whether or not that turns out to be where they work in the long run. And I think it's something unique to see so many partners come together and work towards those shared goals, even though they might be slightly different. And for Endeavor Health to say, it's okay that we have this whole program that as of now has led to 7 people actually working for us. I wonder if any of you could speak to that and how you're defining success and how you came to agreement upon some of those outcomes and measurements.
Yeah, and I can actually speak to that. Susan, if you wouldn't mind, I think this would be a good opportunity to share those workforce slides that we had at the end of the presentation. And you can go to the next right away. So April, I'll kind of talk through that as presenting these slides as well. But no, you're totally fine. It really does. I think it's a great question that segues into this and gives us an opportunity to share very holistically what our division seeks to accomplish. And you can read our mission on the left side of the screen there, but the big idea, and I guess you could use the word goal there, is to sit down at the table and say, an outline rather, what barriers and challenges exist to people gaining employment currently. Is that they are lacking certain education? Are they lacking certain employment like credentials? Do they just not have certain things like financial literacy that they need? And figuring out how can we connect them to each of these different resources so that we can get to that final point, as Susan and I mentioned earlier, of employment. And so we have our priorities of the Workforce Development Division on the right. That first one being expanding workforce opportunities to underserved populations. Our second one, as I mentioned, reducing barriers that are preventing job seekers from entering the workforce. That third priority is kind of one of my favorites, and one of my goals for Aspire program as we continue to build it out is figuring out how can we truly cement this, where from day one you have an understanding of where you're going to end up and where you can end up as long as you're able to check off certain boxes. And if you attain these credentials, if you get that degree or whatever it may be for your specific career interest, you know where you'll end up at the end of the day. And then that last priority is really highlighting businesses and business owners with the minority and women-owned businesses that historically haven't received the proper shine that we feel that they've deserved. And all four of those priorities speak to just what we hope to achieve and what we feel is most important. Again, and Susan, if you wouldn't mind clicking to the next slide. I think the GROW program through the City of Evanston also touches on this very well. GROW at the bottom, you can see, stands for Gaining Resourceful Opportunities While Working. And the GROW program, in essence, really just focuses on how can we make people's lives easier? Because we understand that, as I mentioned earlier, employment, or rather lack of employment, is to me a public health issue, because without that, there are so many other things that are necessary in our lives that you're not able to access. And that could be just groceries, that could be childcare, that could be attaining education, that could be healthcare. So without that, it's often difficult for people to take advantage of and have those essential resources in their day-to-day lives. And so what we do is, often with almost everyone we see and offer our services to, we start off with a career assessment, and then we move on to, after that, understanding where they are in their career journey and where they've been. Now we can connect you to the proper professional development resources that you may need, which looks different for everyone. Some people may need a little more, some people may need a little less. And from there, then we can move on to that third one, which is getting you in touch with our wraparound support services. Do you need certain credentials? Do you just need help with financial literacy because maybe you're in an okay financial situation, but just the management and understanding of your funds isn't the best? Maybe you need mental health resources. Figuring out, again, on an individual basis, and that's something we pride ourselves on, is each person's case and situation is different from the next. And so we have to, as much as we can, of course, because we can't be perfect in that area, but as much as we can, we want to make sure we are actually connecting with those people and making them feel and know that we understand that they have a unique story. And so after we move past that point of wraparound support services, you can see the different career industries that our division highlights and has an emphasis on. And then that last piece, I think, would really speak to what our goal is of employment. And that's in essence, I guess, a long-winded answer for your question, April. And really just, although we, at this moment, I wouldn't share a certain number or figure with you, when we look up and we kind of look around and we're walking in the streets of Evanston and the Evanston community, I think Susan and Jessica would agree with me that being able to see that difference and know that we've gotten people into a better situation, and a far better situation than they've come to us before, whether they were unemployed or underemployed or just unsure of their career path and outlook, we were able to help them get to a point where they feel confident. And that's something that I really do think is important, is reinstilling confidence in people. And one example of that I can speak to is something I've learned in my my time in this role is that each year, Evanston Township, about a quarter of their graduating class does not take the traditional path of going to a college or university. And on top of that, about 50 or 60% of those students may not finish that first year. So they find themselves in a position now where they need that guidance. They know they still want to do something. They want to spend their time doing something and really build out their life, but may not know exactly where to start or who to go to for that. And that's where we come in, both with the Aspire program specifically, but in that greater sense, just with workforce as a whole. And I know we're very close to the end. So Susan, if you could click to this one last slide for me. And that's sort of where initiatives as Evanston Workforce Connect come into play. And essentially, in a nutshell, what this is what we want to see it become is a one-stop shop for every employer in Evanston in a perfect world to have an account set up on here so we can reduce those barriers of, oh, I have to go to 10, 15, 20 different websites to apply for jobs. I have to re-upload my resume a 15th time. I'm rewriting the cover letters. I'm filling in my job history and feeling like essentially that application fatigue, and eliminating that so that you can, if you're a job seeker rather, come on to Evanston Workforce Connect, you sign up for your account, and you have everything right there in front of you without having to just work yourself too much in order to attain that employment. So again, our goals there would be getting people to that employment, instilling that confidence and doing everything we can to streamline our service sources and get people into the positions where they feel successful.
That is really interesting. I'm excited to check that out and see what it's all about. Thanks for sharing, Jeremy. We only have 2 minutes left. I've dropped a link to just a very brief survey in the chat to get your feedback on our Lunch and Learns and what else you would like to see us cover in these events. Does anyone have a final question?
I have a question that I should have asked earlier. I'm sorry. Melissa Gomso with the CLBP. We're having great success getting people who are interested in the apprenticeship, but it's been a bit more of a challenge to get tests to run into our lab as well as placement for the apprentices. And I think it often comes down to finances. So I was just wondering how you get the leaders of the healthcare system to buy into this, because obviously when you have these senior folks, it's taking away from the work during the training, and that costs money. So I was wondering if you could just talk to that a little bit.
Sure. So we, at this time, it's an internship, not apprenticeship. I think that there's a slight difference, but it's all paid for. It really came down to our executive leadership team making the decision that we as a system were going to create a community investment fund, that the organization was going to set aside millions of dollars a year that we would be donating across our communities in which we're located. There are 21 recipients of our community investment fund grants this year, ASPIRE Evanston being one of those recipients. So we as a system for 3 years in a row have given the City of Evanston $200,000 as part of a grant. The city also decided they wanted to invest in workforce development and used their ARPA funds. And so it was an easy sell in a way, because we wanted to invest in the community. And yes, initially we wanted to hire people, but ultimately what we realized is we want to introduce young people and youth and young adults to the healthcare world and expose them and build relationships with them. What has continued to sell ASPIRE Evanston year after year is that those individual stories. So while we've only hired 7 people, the 7 people we have hired And the 3 who left are all now going to be exploring additional education in healthcare. They are working for us while they are going to school and getting additional degrees so they can continue their career. And we have seen a direct impact, not just with the intern, but within a multi-generational household. So we have an intern who now works in our pharmacy. Her brother is getting the ASPIRE scholarship at Oakton College. They're both now going to explore healthcare, and he was not part of our program. And so I think that we see the return on investment in people who do stay with us. So it actually, we could talk offline. I can give you all kinds of selling points, but it's really been so meaningful and impactful for our team members who have hosted interns. That's what's selling it to our executives to continue to invest in the program.
Those are great stories. Thank you for sharing. And I think probably it's great to let people explore and find out they're not interested before they spend thousands in college too, right? So they get in there,
Yes.
they like it, and then they can go down a different path. So I think that pays off in the end too.
Yes, and that is one of our metrics that we as a system are looking at is, have we helped them get a step closer to creating a career plan for themselves upon graduating from high school? Not that they're going to come work for us. And maybe they decide they don't want to work in a hospital, they want to work in skilled nursing. And so there are community partners Evanston has that we can refer them to also, if that's what they want to do.
Well, thank you so much for sharing today. Great information. You're doing great things. Thank you.
Thank you.
That I'd keep it open a couple more minutes. Does anybody else have a question? And I'll be putting these slides up on the website along with the recording tomorrow. I'll send it out in a newsletter so more of our collaborative can learn about this great partnership. Thank you so much to Susan and Jessica and Jeremy for putting this together and presenting. I am very impressed with this model. I'm excited to see you expand it into other communities as well, and would love to hear more about that in the future. Thank you all for joining. Much appreciated. See you at the next Chicagoland Healthcare Workforce Collaborative event. Have a great day.
Thank you.
Thank you.
Thank you all.